So next class is immunization. So immunization is the important one. Okay. So for definition, the immunization is the process to protecting the individual from the disease through live or killed or attenuated organism to the individual system to create you immunity. Okay. So what is the immunity? It's a definition of the immunizations for immunity. Immunity is the securitist against to the particular disease and non-susceptibilities to invoice and pathogenic effect to the foreign microorganism and toxic effect. So this is it will be happen to the example after COVID will get the immunity system totally will damage it. So particular disease in foreign body it's enter. So every toxic will be affect to the bodies. Okay, that one. So there is the active and passive both immunities there. Active means it's a produced, so it is the stimulating to the immunological mechanism through the administration of the antigen. Usually priorly or natural, they will give exposed to the infections. So this is the active immunization agent. It's no for the vaccines. So passive means passive immunity is produced to the temporarily and supplying to the pre-performed exogenous animal and human antibody to suppress the disease. So this is also exposure with the infections. So it's a ready to made antibodies. They give the antisera immunoglobulins. Okay. So the immunoglobulin is the antibodies. The antibody is the group of proteins present to the blood. It's the intestine secretion of the respiratory secretions. Okay, then antigen. Antigen is the foreign substance. It includes the bacteria, virus, and toxins, foreign proteins that stimulate to the formation of the antibodies. Okay, toxins. Toxin is the poison substance. It's usually is produced to the invading macroorganisms. So toxin and antitoxin means it's an antibody for the response of the toxin. Okay, then toxide. Toxide is a treated to the any antigenic qualities of should be destroyed and treated. Okay, vaccine. Vaccine is the immunobiological substance which is the produced to the production of the disease. It's an active production to the antibodies and immunomechanisms. So this is it's a live attenuate organism inactivated. So they both this mechanism is kill the organisms to cellular fractions and this is more preparation to the subunit vaccinations. So recommend vaccines. Then live attenuated vaccines, bacteria, it's a PCG, typhoid and plague. Viral means oral polio, measles, mumps, rubella, and yellow fever, influenza. So rectitial is the happy and typhus. Okay, killed and inactivated vaccine means that bacterial pertussis, typhoid, cholera, and plague, CS meningitis. Viral means rabies, hepatitis B, influenza, sulca, polio, Japanese encephalitis. So this taxide is the diphtheria and tetanus will be there. Cellular means mangonical and pneumonical vaccines. So combination is that TPT means diphtheria and pertussis, tetanus. MR means mumps, measles, and rubella. T means diphtheria and tetanus. HIP means hepatitis B, influenza B, and hepatitis B. So this is pentavalent means diphtheria, tetanus, hepatitis B, hemoglobin. This is more nowadays preferable for the pentavalent. Okay, so national immunization schedule. So it should be planned according to the community. It's relevant to the health problems. It's a must effective and feasible for the community peoples and to the immunization programs. Okay, so WHO immunization program 1974 they launched. So that the January exported to the immunization programs. Okay, so again, six killer disease of the in India API they was launched for January 1978. Okay, so national immunization schedule is the at the birth they will give PCG, it's intradermal at birth POP also they will give and hepatitis B they give. Then 6 weeks PCG is not given to the birth if they can give. Then pentavalent and OPV1, then 6 weeks hepatitis B and rotavirus. So this everything they mingle, they will give pentavalent. Okay, 10 weeks pentavalent 2, 10 weeks OPV2, 10 weeks hepatitis B2, then pentavalent 3, OPV for 14 weeks, 9 months measles they can give. Okay, so next for 6 to 24 months, TPT, OPV, and measles. So 5 to 6 TT, DT, then TT, yearly pregnancy TT1, after birth is TT2. Okay, general contraindication of the vaccine means that allergic will be there. Then OPG, measles and all, depending that administration situation, fever and all will be there. It's a immunodeficient disorder, leukemia, lymphoma, generalized malignance and all will be there. So acute illness means fever above 38 will be there. Then special risk of group is complication and infection disease of the high include those chronic lung disease and all, it will be the Down syndromes. So low birth weight, it will be more complications. So condition not to be taken, contraindication of the vaccine. So what are the condition not to be taken? So mild or moderately ill patients, immunosast. Okay, so their malnutrition, low grade fevers, mild acute respiratory infection, diarrhea people, and minor illness and all, they can't to take the vaccines. Okay, reaction of EPI. So that is what are the reaction will be there? Mild fever will be there, local pain, malaise and irritabilities, transit reactions, lump and papillary appearance of the third week of the BCG vaccination. Then painful tender will be there. Then size 6 to 10 papillary diameter is will be there. Nodules. Okay, no treatment necessary. After it will be suppressed. Okay, then conclusion. The immunization process is whereby the person is made and immunoresistant to the infection. This is typically administration of the vaccines. Okay, next class we are going to see. Next year, prevention of uncommunicable disease. What is the prevention communicable disease? So it is a illness due to specific infections or toxic product able to be directly or indirectly for the men to man, animal to animal from the environment. Okay. Then epidemiology is host pathogen environment will be there. So dynamic of the disease transmission is the source of organism. Then susceptible host, means of transmission. Mode of transmission, direct or indirect. So direct means skin to skin, mucus to mucus, and mucus to skin. Okay. So this is a direct contact. We see droplet infection. Droplet means direct projection of the spray, saliva, nasopharyngeals, coughing, sneezing, speaking. So this is and all. It will be happen to the TB patient or respiratory infection patients. Then contact with soil. That any soil that gets played, they will get for lukewarm, lava, tetanus and all they will get. So next, inoculation into the skin and mucus. So rabies and infected needles and all they will get. Then transplacental. Transplacental means to the delivery time, they will get for the HPV, AIDS, and torch agents and all. Okay, so indirect means flies, fingers, vomit, then food and fluids. Okay, this is 5F. Then vehicle bond means water, food, ice, blood, and serum, plasma, tissue, and organ. Okay, indirect means hairborne. Hairborne means respiratory infection of the chickenpox, measles, mumps, rubella, diphtheria, meningitis, whooping cough, ARI, TB, and all. Okay, so intestinal infections means it's a polymyelitis, viral hepatitis, acute diarrheal disease, typhoid fever, and food poisonings, amoebiasis, Dionysus, Ascaris, and Hugumam infestations. Okay, disease of prevention and control for the washed hands often every procedures. Okay, preferring food, heating, toileting, everything. Okay, then get vaccination. So immunization can reduce the chance of to the contracting of the many disease. So only can take antibodies when necessities. Then exactly we can do. Don't stop taking the yearlies and symptoms have to go away. Okay, so disease to prevention of control, wash hands often, get vaccinated. Get vaccinated, use antibiotics, then stay home. Signs and symptoms if you're getting infection. Smart about food preparations. So special attention to the cleaning the hot zones, please. Okay, this is don't share the personal items. toothbrush, compound, razor blade, and avoid sharing the drinking glasses. Okay, control into the reservoir means yearly diagnosis, precise treatment, epidemiologic investigations, then installation, prevention, control measures, notification, isolation, quarantine. So this is you just remember to your COVID, then you can try the prevention and controls. So interrupted transmission is the breaking the chain to the transmission. Susceptibility source means active immunization, passive immunization, combined and passive immunization that we need. Non-specific measure means it's a better housing, water supply, sanitation, nutrition, education. So this is and all we should do the implementation of the measures. Okay, next class. So this is for family environment. Family environment means so this class next class we can see. Okay. Thank you guys.